If a clot develops in a vein and stays there, it's called a thrombus. If the clot detaches from the wall of the vein and travels to another part of your body, it's called an embolus. Pulmonary embolism is when this embolism or mobile clot lodges in one of the vessels of the lungs. Therefore, there will be restricted blood flow to the lungs and increased pulmonic pressure in these vessels. Massive pulmonary embolism or PE is an emergency condition that accounts for more than 30% of death after a positive diagnosis. And its effect in COVID-19 is extremely fatal. Today, we are going to discuss pulmonary embolism, its causes, pathophysiology, diagnostic approach, and management in detail. About 8 to 10% of people with pulmonary embolism die on the spot due to cardiogenic shock. In the emergency room, they present with complaints of shortness of breath, tachycardia, often hemoptysis, and chest pain or discomfort. While taking the history, DVT, or deep venous thrombosis, is one of the most crucial precursors we need to look for. So who's at risk, and what causes these clots to break into the blood in the first place? People at risk for developing a blood clot are those who have been inactive or immobile for long periods of time due to bed rest or surgery, have a personal or family history of a blood clotting disorder, such as deep vein thrombosis or pulmonary embolism, have a history of cancer or are receiving chemotherapy. And of course, the people with a history of cardiovascular diseases, obesity, and pregnant women who have given birth in the past 6 months. Post-operative patients which are unable to move due to surgery and immobile for prolonged periods are one at the most risk in the critical care unit. Signs and symptoms of PE depend on the severity of the disease. Therefore, a classification on the basis of clinical presentation divides PE into 2 categories: a silent pulmonary embolism and a violent pulmonary embolism.
Ouch.
Okay, not violent, but symptomatic, which are violent indeed. The first sign is often the shortness of breath and chest pain on exertion. There could be hemoptysis or bloody sputum and tachycardia. When a patient presents with complaints similar to heart attack, with hemoptysis or coughing, suspect PE. Next, we will look into how pulmonary embolism is classified. Pulmonary embolism, PE, can be classified based on the time course of symptom presentation or acuity, that is, acute and chronic, and the overall severity of disease stratified based upon 3 levels of risk as massive, submassive, and low risk. First, let's discuss acute and chronic PE in short. Acute pulmonary embolism is when there is the sudden development of pulmonary infarct which may result in sudden occurrence of symptoms.
Ouch.
After acute PE, there will be increased pressure in pulmonary arteries, called pulmonary hypertension. Normally, mean arterial pressure, also called MAP, in pulmonary arteries is 25 mmHg at rest and 30 mmHg while exertion. If the pressure in these vessels exceeds the upper limit, it will be called pulmonary hypertension. When pulmonary hypertension or PAH persists for more than 6 months, it will be a chronic pulmonary embolism. Depending on the severity, the PE is classified into massive, submassive, and low risk.
Ouch.
In the next lesson, we will learn the difference between massive, submassive, and low-risk pulmonary embolism. Thanks for watching.